I joined the Jordan Young Institute because they have a great reputation in joint replacement in the area. It's a great practice with excellent partners that do good work and take good care of people. I work at the Sentara OrthoJoint Center at Sentara Hospital. What I really liked about orthopedics is that it really improves patient lives. It really takes people that are debilitated, that have difficulty getting around and moving comfortably, and makes them comfortable, and the outcomes are great. And the patients are very grateful for it. I treat people primarily with arthritis. There's different types of arthritis. The most common form is osteoarthritis, and that's the kind of general wear and tear type arthritis that people get with the joints. I mostly treat hip and knee arthritis, and the treatment options for that range from non-surgical options to surgery. The surgical options are usually arthroscopy, partial replacement, or total replacement. The hip replacement's quite an extensive procedure. It is surgery to replace the actual ball and socket of the hip joint, and so in general that's reserved for when people have a completely worn out hip joint. I do all my hip replacements via what's called the anterior approach. It's an incision in the front of the hip that allows us to access the hip without taking out some muscles that needs to happen with other types of approaches. And it seems to be a little bit less invasive. The recovery seems to be much quicker, especially early on. People do very well and they're up right away, and generally stay in the hospital for very short periods, and they're able to get around and function quickly and return to work quickly. What's an advantage for me with the anterior approach is that during the surgery I can use live x-ray to look at the entire surgery, so I can see exactly what I'm doing, which is impossible with other approaches. So that lets us get the components in the right position. It lets us equalize people's limb lengths and the amount of offset they have, which is the distance of the femur from the pelvis. And in order to recreate that perfectly, I created what's just a simple overlay to put on top of that fluoro machine, that x-ray machine in the operating room, in order to judge the length of the limb and to make sure we have the components just right for the patient. So this is what we do when we do a hip replacement. In hip arthritis, this ball and socket joint of the hip is arthritic, and so the cartilage is gone and you get bone contact, and that's very uncomfortable. In order to get the pain to go away, we do what's called a hip replacement, where we remount a socket inside the pelvis and put a cup. Inside that cup is usually a plastic liner. And then we put a metal stem down the femur, and this metal stem has a ball on it, and now that hip joint articulates, and there's no pain because there's no nerve endings in that ball and socket, and pain goes away from hip arthritis. A knee replacement, like any other joint replacement, is reserved for when people have end-stage arthritis and other options aren't working. So when things like medicines and injections fail, then generally a knee replacement is a good option for people with end-stage arthritis. And sometimes we can do what's called a partial knee replacement, where we replace just part of the knee joint that's destroyed. And other times when the whole knee joint is bad, we need to do what's called a total knee replacement and replace that entire joint. So for pain control after joint replacements, we perform a lot of different adjunctive modalities. We usually use spinal or general anesthetic to keep people comfortable during the surgery. Both of those are effective. And then we do, for knee replacements, local blocks in order to numb the nerves around the knee to make it more comfortable. And then during the surgery, for both hips and knees, we use a lot of local anesthetic to make the joint less uncomfortable after surgery. And people do very well with that. With medical treatment too, and with standard kind of post-operative medicines, people are able to really recover well with much less discomfort than they did years ago. At the Sentara OrthoJoint Center, we have an express track which allows us to recover patients rapidly. We're able to do surgery, and then the next day the patient's able to leave the hospital. The express track is perfect for people who are relatively healthy, who are able to get up early after surgery, are motivated to do therapy, and want to get back to work quickly and back to activity quickly and recover at home. What I really love about joint replacement is that people do get better, people do well, and it takes people that are having trouble mobilizing, they're having trouble getting around, they're having trouble working, they're having trouble enjoying their recreational activities, and it really allows them to do that comfortably, and they appreciate it, and it's nice to see them get their function back and get their quality of life back.